COVID and vaccine dominated questions for the Chief Minister, with a number focusing on housing. In the programme broadcast every single quarter since 2012, several viewers asked how the government can make vaccination a condition for visiting the elderly and the sick, and for football matches, etc., questioning whether this will be temporary or the way forward. There were accusations that GHA and ERS staff who had rejected the vaccines were being coerced into taking them, with intimidatory comments such as "you will lose your job" or suffer consequences.
I'm not suggesting that he's not telling us what may or may not have happened to him or have been reported to him, but the Minister for Health has been very clear. Those who do not take the vaccine will be able to continue, but with different application of PPE to protect them from circumstances in which they may be exposed to the virus during the course of their work, and to protect those who might come into contact with them if they were to have the virus. I've seen today a statement by Unite the Union, which I think is very responsible, and the advice of the union is get a jab if you can.
A question on the importance of collecting COVID data to put the pandemic in perspective, and asking Mr. Picardo whether this will be a priority for his government.
The most interesting data, I think, as we go forward, will be what is the effect of the vaccination on future virus infections and the consequences of those infections. Because we know that the vaccination program is not going to entirely immunize us against the virus. People will continue to get the virus. 1 in 20, if you take the 95% efficacy, more or less 1 in 20 people will still take the virus. But in the context of those that do get the virus, if they've had the double dose and it has the full effect, will they require hospitalization? Will they, unfortunately, die from the virus? The suggestion is that we'll see 1 in 20 get the virus, but we won't see the numbers of people going into hospital or the numbers of people dying that we've seen in the past. That will be very interesting data. And Gibraltar will be one of the places which will first be able to inform the world of what a whole population vaccination programme produces in terms of the data going forward.
The Chief Minister offered statistical information on where we were in terms of vaccines.
We are already at over 90.5% of addresses in Gibraltar having had a second dose. That is an extraordinary figure, which means that we are hours, 96 working hours, etc., away from being able to say everyone in Gibraltar has been offered a dose and had their first and second jab.
On other matters, Chief Minister confirmed he was in advanced discussions with the MOD on the pedestrian crossing across a runway, and that the government would meet the opposition to go over the plans for the Parliament building. This renovation, he said, would take place when Gibraltar was finally able to support projects of this nature.